A resident with Parkinson's disease shows difficulty starting movement during transfers. The CNA should A. Pull them forward to help initiate motion. B. Encourage them to rock gently before standing. C. Support only their weak side. D. Lift under their arms. Answer B. Gentle rocking helps Parkinson's patients overcome freezing episodes safely without pulling or lifting. When repositioning a resident who has a feeding tube, the head of the bed must remain at least A. 15 degrees. B. Flat if comfortable. C. 45 degrees. D. 30 degrees. Answer D. Elevating the head 30 to 45 degrees prevents aspiration and reflux in residents with feeding tubes. A resident tells the CNA that she refuses her morning medication. The CNA should A. Try to convince her forcefully. B. Record the refusal and notify the nurse immediately. C. Hide the medication in food. D. Offer the same medication later without telling the nurse. Answer B. Residents have the right to refuse treatment. CNAs must document and report refusals promptly. The CNA finds a diabetic resident shaky and sweating before breakfast. The best first action is to A. Give them orange juice or glucose tablets. B. Wait until breakfast arrives. C. Check their temperature. D. Have them lie down and rest. Answer A. These are signs of hypoglycemia. Prompt glucose intake prevents worsening of symptoms. During perineal care on a female resident, the CNA should cleanse A. Back to front. B. Side to side. C. Front to back. D. Circular motion only. Answer C. Cleaning from front to back prevents bacteria from the rectal area from contaminating the urethra. A resident who recently suffered a stroke suddenly begins slurring speech. The CNA's next step is to A. Call the nurse immediately. B. Offer water. C. Lay the resident flat. D. Wait to see if it improves. Answer A. Slurred speech may indicate another stroke. Immediate nurse notification is critical. When documenting, the CNA should record A. Future predictions. B. Personal opinions. C. Possible diagnoses. D. Observations and resident statements. Answer D. Only objective observations and resident-reported information should be recorded in medical documentation. A resident complains of new pain that the CNA cannot relieve. The CNA should A. Notify the nurse immediately. B. Offer distraction. C. Massage the area. D. Wait until shift change. Answer A. New or unrelieved pain may signal a serious issue and must be reported right away. When assisting a resident who uses oxygen, the CNA must never A. Check for kinks in tubing. B. Apply water-based lotion. C. Use petroleum jelly. D. Ensure tubing is secured. Answer C. Petroleum-based products can ignite easily near oxygen, creating a fire hazard. The CNA overhears another aide mocking a resident's speech. The correct action is to A. Ignore it. B. Tell the nurse privately. C. Confront loudly in public. D. Join the conversation. Answer B. Report unethical or abusive behavior immediately. Resident dignity and respect are top priorities. A resident with COPD is breathing rapidly and seems anxious. The CNA should A. Encourage slow, pursed lip breathing. B. Provide a paper bag to breathe into. C. Lay the resident flat. D. Increase oxygen without permission. Answer A. Pursed lip breathing helps improve exhalation and reduce shortness of breath in COPD patients. Before assisting with postmortem care, the CNA should first A. Ask the family for permission to begin. B. Confirm death has been officially pronounced. C. Remove all tubes immediately. D. Document before care. Answer B. Postmortem care can begin only after the nurse or physician legally confirms death. When performing range of motion exercises, the CNA should A. Move joints quickly for efficiency. B. Hyperextend each joint once. C. Continue despite mild discomfort. D. Stop if the resident complains of pain. Answer D. Range of motion exercises should never cause pain. Stop immediately and report discomfort. A confused resident begins to wander toward the exit. The CNA should A. Physically block them. B. Calmly redirect them to a safe activity. C. Shout their name. D. Call security. Answer B. Gentle redirection helps ensure safety without confrontation or escalating anxiety. If a CNA forgets to record a procedure until hours later, they should A. Skip the note. B. Write it as if done now. C. Record it as a late entry with accurate time. D. Ask another aide to chart it. Answer C. Late entries must be labeled as such, showing honesty and accuracy in documentation. A resident's dentures fall on the floor during cleaning. The CNA should A. Rinse them under hot water. B. Report and clean according to facility protocol. C. Put them back immediately. D. Leave them soaking overnight. Answer B. Contaminated dentures should be disinfected and reported to maintain hygiene and transparency. A CNA enters a room and finds the resident unresponsive on the floor. The first step is to A. Check for breathing and pulse. B. Begin CPR immediately. C. Run for help. D. Move the resident to the bed. Answer A. Assess responsiveness, pulse, and breathing before taking further emergency action. When caring for a resident who is dying, the CNA's main focus should be A. Extending life at all costs. B. Comfort, dignity, and emotional support. C. Discussing funeral arrangements. D. Offering only physical care. Answer B. The CNA's role is to promote comfort and dignity, supporting both resident and family. If a resident's family insists on a treatment the resident refused earlier, the CNA should A. Follow the family's wishes. B. Respect the resident's prior decision. C. Persuade the resident to comply. D. Avoid involvement. Answer B. Resident rights take priority over family wishes. Autonomy must be honored. Which of the following is a correct example of objective data? A. Resident seems sad today. B. Resident states, I feel dizzy. C. Resident's temperature is 101 degrees Fahrenheit. D. Resident might be tired. Answer C. Objective data are measurable and observable facts like vital signs. A resident's 4 alarm starts beeping. The CNA should A. Adjust the flow rate. B. Silence the alarm. C. Notify the nurse immediately. D. Disconnect the tubing. Answer C. Only licensed staff may handle 4 equipment. CNAs must report alarms immediately. The CNA notices bruises in different stages of healing. The best first action is to A. Ask the resident about them privately. B. Report findings to the nurse. C. Take photos. D. Ignore unless the resident mentions it. Answer B. Unexplained bruises may indicate abuse. Report findings without assumptions. When assisting with meal setup for a blind resident, the CNA should A. Feed them directly. B. Avoid mentioning spills. C. Mix all foods for convenience. D. Describe the food using a clock face method. Answer D. Using the clock face technique helps blind residents locate food independently. The CNA accidentally gives a resident the wrong lunch tray. The correct response is to A. Swap trays quickly before they notice. B. Report the error immediately. C. Wait to see if it causes a reaction. D. Apologize but take no further action. Answer B. Any potential food or medication error must be reported to ensure resident safety. If a resident's blood pressure reading seems unusually high, the CNA should A. Record it and move on. B. Retake it after a few minutes and inform the nurse. C. Ignore it if the resident feels fine. D. Lower the cuff pressure. Answer B. Recheck to confirm accuracy and report abnormal results promptly. A CNA must wear a gown and gloves when entering a room marked A. Droplet precautions. B. Airborne precautions. C. Contact precautions. D. Standard precautions only. Answer C. Gown and gloves are required for contact precautions to prevent direct contamination. The CNA observes another aide giving medication. The correct action is to A. Help them distribute. B. Report the incident to the nurse. C. Ignore it if it helps save time. D. Tell the resident to refuse. Answer B. CNAs are not permitted to administer medications. Report immediately for patient safety. A resident who is hard of hearing keeps nodding but not responding correctly. The CNA should A. Speak louder. B. Repeat instructions faster. C. Move closer and shout. D. Face the resident and speak clearly. Answer D. Facing the resident ensures they can lip read and understand. Shouting may distort sound. When applying a restraint, the CNA should A. Tie knots for security. B. Tie quick-release knots to the bed frame. C. Attach to the side rail. D. Make it as tight as possible. Answer B. Restraints must allow quick release and be tied to bed frames, never side rails. During catheter care, the CNA should A. Wipe from the meatus outward. B. Clean from tubing toward the urethra. C. Leave catheter unsecured. D. Use vigorous circular motions. Answer A. Cleaning away from the urethra reduces the risk of introducing bacteria. When assisting a resident who has right-sided weakness after a stroke, the CNA should help them dress by A. Putting the clothing on the strong side first. B. Dressing the affected side first. C. Allowing the resident to do it alone. D. Asking another staff member to assist. Answer B. Dressing the affected side first allows easier movement and reduces strain or injury. This technique promotes independence and comfort for stroke patients. A CNA notices a resident's urinary output is dark and has a strong odor. The best immediate action is to A. Add more water to the urine container. B. Report the finding to the nurse. C. Ignore it if the resident feels fine. D. Clean the collection container immediately. Answer B. Changes in urine color or odor can signal infection or dehydration and must be reported promptly to the nurse. Before using a mechanical lift to transfer a resident, the CNA must first A. Test the lift with their own weight. B. Ask another CNA for permission. C. Review the care plan and ensure all parts are working. D. Place the resident in a wheelchair. Answer C. The care plan outlines transfer methods. Checking the lift ensures safety and prevents injury to both resident and caregiver. When measuring a resident's pulse, the CNA counts for 1 full minute if A. The resident's pulse is regular. B. The resident's pulse is irregular. C. The resident is sleeping. D. The resident is talking. Answer B. An irregular pulse requires a full minute count to ensure accuracy, as rates may fluctuate. Which of the following situations violates a resident's right to privacy? A. Closing the curtain before providing care. B. Discussing care with the nurse privately. C. Leaving the resident's chart open on a desk. D. Asking permission before bathing. Answer C. Leaving confidential information exposed is a breach of HIPAA and violates patient privacy rights. The CNA observes a pressure sore beginning to form on a resident's heel. The best action is to A. Apply lotion and ignore it. B. Cover it with a bandage. C. Report it immediately to the nurse. D. Massage the area firmly. Answer C. Early reporting allows for quick intervention and prevents the sore from worsening into a serious wound. When providing oral care for a resident who is NPO, nothing by mouth, the CNA should A. Use water and mouthwash. B. Use a moist swab and avoid swallowing. C. Skip oral care until feeding resumes. D. Offer ice chips instead. Answer B. NPO residents still require oral hygiene using moist swabs to maintain comfort and prevent infections. When assisting a resident with ambulation after surgery, the CNA should first A. Encourage fast walking. B. Hold the resident's arm tightly. C. Remove all assistive devices. D. Apply a gait belt for support. Answer D. The gait belt provides safe support and control while preventing falls during early ambulation. A CNA notices a resident hoarding food in their room. The CNA should A. Take away the food immediately. B. Inform the nurse about the behavior. C. Report it to dietary services only. D. Ignore the behavior. Answer B. Hoarding may indicate fear, confusion, or psychological distress and must be reported to assess underlying causes. If a CNA spills a chemical cleaning agent while working, the first step is to A. Wipe it with a towel. B. Leave it for housekeeping. C. Follow the facility's safety protocol. D. Ignore it if small. Answer C. Safety Data Sheet, SDS, procedures must be followed immediately to prevent harm to staff or residents. A resident refuses their scheduled bath. The CNA should A. Force the bath to maintain hygiene. B. Respect the resident's decision and report it. C. Leave the room without comment. D. Tell the resident they must bathe. Answer B. Residents have the right to refuse care. The CNA should respect their choice and notify the nurse. A CNA observes another aide speaking rudely to a resident. The CNA's best action is to A. Ignore the behavior. B. Speak to the aide privately later. C. Join the conversation. D. Report it immediately to the nurse or supervisor. Answer: D. Verbal abuse is never acceptable and must be reported immediately to protect residents' safety and dignity. Which of the following steps ensures correct catheter care? A. Cleaning from the drainage bag toward the resident. B. Cleaning from the urethra outward. C. Cleaning only the drainage bag. D. Using soap directly inside the catheter. Answer: B. Cleaning from the urethra outward prevents bacteria from being introduced into the urinary tract. When a resident has a seizure, the CNA should first: A. Hold the resident down. B. Place a tongue depressor in the mouth. C. Clear the area to prevent injury. D. Leave the room immediately. Answer: C. The CNA must ensure the area is safe, avoid restraining the resident, and call for help. Which of the following would be considered neglect? A. Forgetting to close the curtain before care. B. Failing to turn a bed-bound resident as ordered. C. Reporting a medication error. D. Checking vital signs twice. Answer: B. Neglect involves failure to provide necessary care, which can cause harm or pressure ulcers. When performing hand hygiene with soap and water, the CNA should wash for at least: A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 1 minute. Answer: C. The CDC recommends washing for at least 20 seconds to effectively remove pathogens. A confused resident keeps trying to leave the facility. The CNA's best initial response is to: A. Restrain the resident. B. Redirect them calmly and notify the nurse. C. Yell to get their attention. D. Lock the doors immediately. Answer: B. Calm redirection helps avoid agitation. The nurse must be informed to ensure safety and possible supervision changes. When assisting with feeding, if a resident begins to cough and choke, the CNA should first: A. Offer water to help swallow. B. Perform the Heimlich maneuver. C. Stop feeding and ask if they can speak or breathe. D. Continue feeding slowly. Answer: C. Assessing the airway helps determine if choking is partial or complete before intervening. Which of the following promotes dignity when providing perineal care? A. Leaving the door open. B. Explaining each step before performing. C. Rushing to finish quickly. D. Skipping consent. Answer: B. Explaining steps maintains trust, comfort, and dignity during intimate care procedures. If a resident's family complains about slow response times, the CNA should: A. Argue and defend the staff. B. Listen respectfully and report concerns. C. Ignore the complaint. D. Tell them to talk to management. Answer: B. Active listening and timely reporting show professionalism and ensure resident satisfaction and quality care.